Hello, and welcome to this instructional video. Today, we will demonstrate the procedure for administering nebulized medication. Please note, this is only the procedure. For information on preparing for the procedure and post-procedure, please watch the Principles of Medication Administration video and refer to 15.6, Medication Administration by Inhalation using a nebulizer, found in the Nursing Care Manual of Procedures. Today, we will learn how to correctly assemble the nebulizer equipment and how to safely administer a nebulized medication. We will start by gathering the equipment. Today, we will need the following. Remember, the key equipment for nebulization is the nebulizer reservoir, the air compressor, nebulizer connecting tubing, the face mask or mouthpiece, and sodium chloride ampule in case you need to dilute your medication further. Before administration, the medication volume will need to be calculated, prepared, and drawn up in a syringe. Next, you assemble the nebulizer as per manufacturer or biomedical instructions, but remember to perform hand hygiene before touching the equipment. Open the medication chamber on the nebulizer and add the prescribed medication. Volumes of nebulizer solution to be administered are often insufficient to obtain efficient nebulization in most nebulizers. Diluting the medication increases the volume nebulized, thus increasing medication output and the duration of the nebulization. Please refer to MSF's Essential Drug Guidelines for dilution amounts depending on age and medication being administered. Attach the mouthpiece or face mask via the tubing to the air compressor. Position the patient upright in a sitting position. If necessary, clear the upper airways by asking the patient to blow their nose or clearing the child's nose. If necessary, ensure that the patient is receiving oxygen via nasal cannula. Turn on the nebulizer and observe for mist. There are two techniques to administer the medication. One using the mouthpiece, or one is using the face mask. If you are going to use a mouthpiece, ask the patient to hold the mouthpiece between their lips and breathe through their mouth, starting with a slow, deep breath. If using a face mask, apply the mask over the patient's nose and mouth. The mask should easily cover the nose and mouth and rest comfortably flat on the chin. Ask the patient to breathe through their mouth, starting with a slow, deep breath. Regardless if the patient is using a mouthpiece or a face mask, the patient should always be breathing normally, in and out through their mouth. Adults and older children should be explained to breathe through their mouth, as droplets might be caught in their nasal passage and less medication can be delivered to their lungs. The medication can reach deeper in the airways by taking occasional deep breaths and holding. So, after about 10 to 15 breaths, the patient should take a deep inspiration and hold it for 5 to 10 seconds, if possible. Continue the treatment until no more mist is seen. Remember to monitor the patient throughout the medication administration for approximately 15 minutes. Nebulizers are often given to patients in respiratory distress, and you need to be able to quickly identify and respond to any deterioration. Monitor oxygen saturation, heart rate, respiratory rate, and changes to respiratory distress symptoms. Once finished, turn off the compressor, throw out the remainder of the medication solution, ensure cleaning or disinfection of the device and the accessories after each use. Some accessories are single patient use. However, if the treatment is going to be repeated in the same patient, rinse the mouthpiece or the face mask with clean soapy water and allow to dry. Congratulations! You have now completed an administration of medication by inhalation using a nebulizer. If you need further clarification, please refer to 15.6, medication administration by inhalation using a nebulizer, found in the Nursing Care Manual of Procedures. Additionally, do not hesitate to contact your supervisor, the medical or technical referents, or the training team. Thank you.